Hey everybody, it's Dan here with Pain for You. Had another question today. Somebody emailed me saying that they've got basically pelvic pain, pudendal neuralgia, and reading in a Steve Ozanich book, it said, if there was nerve damage, most likely if nerves are damaged, they don't conduct the messages properly. Either they go numb or the signals are not transferred, which is, if you're having some nerve pain, a neurological test is probably a good idea. Are your reflexes responding properly? Do you feel the pinpricks of the needles rolling down your leg and up? And are the nerves actually working the way they are supposed to? If the nerve test is fine, but you just have pain, it's most likely this TMS stuff, this mind-body syndrome, this PPD, this stress illness. Because again, damaged nerves don't conduct the way they are supposed to. So a neurological test is a good idea. If that comes out clean, then basically the presence of pain does not mean neurological damage. The presence of pain does not mean a neurological disease or dysfunction of the nerves. It just means that your TMS symptoms are showing up as nerve pain as opposed to somebody's muscle spasms or, crick in the neck or shoulder that hurts, right? Everybody's symptoms show up differently. And so if you do have some type of nerve pain, right? If the doctors have called it something neuralgia, pudendal neuralgia, basically pelvic pain, TMS that shows up in the pelvis, rule out nerve damage, which is fine. But once you've done that, the rest is most likely TMS. It's too much stress. It's stress illness. It's a distraction from emotions that are too overwhelming, scary, and dangerous and don't fit with your self-image. So, again, generally when nerves are damaged, they don't conduct the right way or they even go numb. So, don't convince yourself that you've got nerve damage. And don't use the term neurological damage when in fact you may just have TMS pain showing up as nerve pain. Because again, in a lot of cases, nerves go numb or at minimum they stop conducting properly. So rule out the nerve damage with a neurological exam. And if that's fine, then any pain is not as a result of nerve damage. It's more or less a result of TMS, too much stress. So I hope this helps. Not a doctor, may not have all the technical terms right here, but these are my understandings as to how the nerves and the nerve systems work and what happens with damage, how you get it checked out with the neurological testing, and usually the rest is TMS. Rule in TMS with the various assessments. Go to painforyou.com. There's a downloadable self-assessment. That's one. You can go to danbuglio.com/pain test, and that will give you a TMS type of quiz that you can answer, and it will score you. Any score over 29 means it's TMS and can be healed. And lastly, ppdassociation.org/symptoms. And that is another series of questions that the more you can answer yes to, the more likely it is you've got PPD in their words, which is the psychophysiological pain disorder. And so rule out nerve damage with a neurological test. Also rule out life-threatening things, and that's something I say all the time. Make sure there's nothing intractable that requires medical attention. But all other things that you might find on an imaging study or an X-ray or an MRI or whatever are generally just normal signs of aging and abnormalities, normal abnormalities. So rule out the life-threatening. If it's neurological type of pain, get a neurological exam done just so you know that everything is conducting properly. And if all that's well, then start to rule in TMS, and that's based on all sorts of things, personality types, pain characteristics, how long you've had the pain, all that kind of stuff. And you'll see those types of questions over and over in these various assessments. So nerve pain. It's not necessarily nerve damage. So hopefully that helped answer the question. And for anybody with neurological type of symptoms, that's kind of my take on what you might want to do. And the good news is that even if you do have TMS that's showing up as nerve pain, the solution is still the same, right? The answer is no different. The symptom type, severity, how long you've had it, the location in your body, none of that matters. Trying to find somebody else with the identical set of symptoms, yeah, it might feel good to find somebody with your exact symptoms who got better, but that's not what's required. Rule out the life-threatening. For nerve pain, get a neurological test to make sure that things are functioning as they should, and then rule in TMS. If you can rule in TMS, then the treatment's all the same, right? Feel your emotions, soothe yourself and your nervous system, calm everything down, get the right mindset, and that's it. It's really not that much more complicated. So again, symptoms don't matter, whether it feels like nerve pain anywhere. Follow those steps I just outlined, and then the solution is still the same no matter what. So hopefully you found this helpful, and love you guys and gals, and we shall talk to you in the next video. Thanks.